Hi everyone, this is Dr. Castelein with Brighton Foot and Ankle, and in this video we're going to talk about metatarsal fractures. Fractures to the metatarsals are fairly common. 5 or 6% of all fractures in the body are going to occur in these metatarsals, but 35 to 40% of all foot fractures happen in the metatarsals. So they're pretty common. What exactly are the metatarsals? Well, the metatarsals are these long bones in the foot. We have 5 of them that kind of span from the back area of the foot all the way up to the ball of the foot and into the toes. These bones absorb stress when walking, running, standing, making them very vulnerable to injury. And not all metatarsals fracture equally. It's kind of funny that you would think that they all get impacted the same, but that's not true. Number 5, the 5th metatarsal, is the most commonly fractured bone. Next is the 2nd, then the 3rd and the 4th metatarsal. And least common, but most traumatic when it happens, is the 1st metatarsal. This is because the 1st metatarsal is so much bigger, beefier, wider than the other bones. It can take more stress. But when it does fracture, it tends to be more devastating to the foot because of how important that foot is. Now, there are 2 main ways that fractures happen to the metatarsals. First is acute trauma, such as dropping something on your foot, hitting your foot against something, twisting injuries, fall from a height. And the second way is like a stress fracture. Think of stress fractures as little repetitive trauma to the metatarsals that builds up over time, leading to failure of the bone. This is more commonly in our runners, in our athletes, in our walkers. Traditionally, the stress fracture to the 2nd metatarsal was known as like a recruit or cadet fracture, like in the military, from having to march too much. Symptoms of metatarsals include pain, swelling, bruising, inability to stand and walk for long periods of time. Again, you might not know this and it might creep up on you like a stress fracture, whereas if you fall off a ladder or twist your foot in an ankle sprain, you might feel that pain right away. Again, these symptoms might come on really suddenly in the event of an acute or sudden onset injury, or they may kind of build over time and be more kind of like a nagging or a stress fracture injury. Treatment is going to depend on a couple things for these metatarsals. 1, which metatarsal is affected and where in the metatarsals. A really common injury that is very severe is called the Jones fracture. This little fracture happens in this specific area of the 5th metatarsal where we don't have great blood flow. We'll do a whole video on Jones fractures, but these fractures need to go to the operating room many times to help restore that bone and improve the healing capacity of that bone. Same thing with the 1st metatarsal fracture. If we have a minimally displaced or a fracture that's out of place there, we're probably going to have to take this to the operating room and fix it. We also are probably going to have to keep you non-weight bearing for these 2 fractures because we want the area to heal really well. But if we have a stress fracture or a fracture to the 2nd, 3rd, or 4th metatarsals, these guys are less severe. Mostly because they're in the middle of the foot, and the 1st and the 5th metatarsal can support the area and take extra pressure off of it. But whether you have a simple stress fracture or something more complex, bone takes 6 to 8 weeks to heal. We can't cheat anatomy, and we have to give the area time to heal, and we need to offload it properly during that healing time. The key takeaway from metatarsal fractures, whether they're simple or complex, is that they are extremely common. And with proper diagnosis and proper treatment, they should not slow you down. We should have a full recovery and get back into all your normal activities.